Great. Okay, good morning. Thank you for joining us this morning. My name is Carol DeAndres, and I am the Stakeholder and Public Engagement Manager on the Master Plan for Aging team here at the California Department of Aging. And I am happy to be with you here today for the Implementing the Master Plan for Aging in California Together, or IMPACT, I-M-P-A-C-T. Today is January 25th, 2024, and this is the committee's first meeting for 2024. So welcome, happy new year, and let's get started. I'm going to go ahead and go over a few logistics as everyone starts to log on. This webinar, there is live captioning and American Sign Language is available. Thank you, Tulip and Cindy. And the live captioning is available through your Zoom webinar functions. After this meeting, the meeting slides, transcripts, and recording will be posted to the California Health and Human Services, or Cal-HHS Master Plan for Aging web pages on the IMPACT Committee webpage. And committee members, if you have yet to do so, please update your name display in the Zoom by clicking the upper right corner of your video and selecting rename. Right now it just says IMPACT panelists, so please rename yourself. Thank you. Next slide. We can advance the slide, Jackie. There we go. This is a virtual meeting, and we have some meeting operations that we want you to be aware of. The chat function is enabled for IMPACT committee members, CDA staff, California Department of Aging staff, state staff, or invited guests to share meeting-related resources and information with each other and attendees. And the public is able to view the content shared in the chat during the meeting. The chat and the question and answer functions are not enabled for comments and questions from public attendees. We do have public comment at a later portion of the agenda, and we ask that you hold your public comments until that time, and we will address them at that time. And of course, you can provide written comments at any time to our Engage email box, which is engage, E-N-G-A-G-E, at aging.ca.gov.
So you were in the correct room.
Let's make sure everyone's muted. Thank you. For our public comment, these are operational, this is how we do public comment. Thank you. The attendees joining by phone can press *9 on your dial pad, and the moderator will announce the last 4 digits and will unmute your line. And of course, if you are joining by Zoom, you can click the raised hand button to join, and we'll announce and unmute your line. And please note that public comments is limited to 2 minutes so that we can ensure time for everyone to give their comments. And of course, again, there's our email address, engage@aging.ca.gov, where you can provide written comments. The IMPACT Committee purpose. The purpose of the Implementing the MPA in California Together, the IMPACT Stakeholder Committee, is to advise the California Health and Human Service Agency on the implementation of the Master Plan for Aging, focusing on accountability, outcomes, and the continuous improvement towards the plan's 5 bold goals for 2030. And of course, we could not do this without our IMPACT Committee members. On the next slide, you will see their names. They are donating their time, their talent, and most of all, their expertise. And we could not do this without you. So we thank you so much for your efforts for the IMPACT Committee. And now, this is the agenda. You can see we have a packed agenda, lots of time for IMPACT Committee discussion. And we will 2 highlights are the governor's proposed budget and entering year 4 of the MPA. So Let's get going. I will turn this over to the director, Susan DeMorris, and I'm going to spotlight her. So Susan, hold on. Great. Good morning, Susan.
Thanks, Carol. Good morning. Good morning to everyone. And welcome to our first meeting of 2024. This year is off to a roaring start. If you look at January 10th, when the governor released his proposed budget, a lot has happened in the 2 weeks since then. So we'll be covering lots of topics in today's meeting. Most notably, today we release the third annual report, Master Plan for Aging report, to the legislature. And I want to just thank each and every one of you, whether you were a member of the Impact Committee last year or not, because we're welcoming new members. You all had a hand in the content of this report as we highlighted the achievements, the many achievements this administration, the legislature, and stakeholders made together in 2023. So you produced the content that filled the pages with your advocacy and your engagement and your leadership of the Impact Committee. So thank you. We look forward to talking with all of you down on the agenda about this report and many other topics. Today, we're hoping that we can have, with just 2 hours together and so much happening, we really hope that we can have more of a dialogue and discussion. We purposely don't have a lot of slides today, freeing up room for more engagement and dialogue with the presenters that we're bringing in. You'll hear later in the agenda from Kim McCoy-Wade, the governor's senior advisor on aging, disability, and Alzheimer's. And we will also be joined by Marco Meach, Undersecretary for the Health and Human Services Agency. So we'll get to hear perspectives from them as well. And we're gonna try to mix up the agenda so that there's some report outs, more conversation than we've had probably in the past. I just wanted to touch on, we're gonna rearrange things a little bit on our agenda. Sarah Steenhouse and I are going to start off by talking about what's ahead in 2024. So you might think, wouldn't you close the agenda with that? We're accommodating Kim McCoy-Wade and Marco Meach's schedules and really want them to be part of our meeting. So Sarah and I are going to lead off. This may differ from the agenda that you had in front of you. So we'll talk about what's ahead in 2024, some of our system change initiatives. And before I do that, I want to introduce for the first time to some of you and reintroduce to many of you a key member of the Department of Aging's Division of Policy, Research, and Equity in our Master Plan for Aging team, Jackie Tompkins, who has been promoted since we last met, Dr. Jackie Tompkins, that is, who has been promoted into the role of leading the master plan work at CDA. So Jackie, welcome to you. Welcome back to the Impact Committee in your new role. You've just got off to a fantastic start, and today's agenda and materials and the annual report reflect so positively on you and your leadership. Welcome, Jackie.
Thank you, Susan. I'm definitely very excited to be able to take on this role within our department, but also our state. I've been with the department for over a year now and have really been able to see the impact that our master plan for aging is able to make to our older adults, people with disabilities, and caregivers. And I'm just honored to serve in this position and really excited to get started. Also feel very supported by, again, our leadership here at CDA and the administration. So thank you, Susan, for the warm welcome.
You bet. All right. So the things that I wanted to touch on, I wanted to circle back as a group, with our thanks, the annual MPA Impact Committee letter that follows the release of the annual report. I just want to reinforce for you that it's such a help to CDA, our sister departments and agencies in our work. It's really a guiding force, and it's something that we refer back to often. And I know as you prepare to do that yet again for the third time, I just want to let you know it is very, very helpful. It's also helpful, the one-page fact sheet that was developed as part of the Day of Action is a tool that we refer back to regularly and really helps keep us focused on the priorities of our stakeholders. I wanted to hit on just a couple points. As I see it, the MPA annual letter or the Impact Committee annual letter and the fact sheet, focuses on 3 areas: equity, preventing and ending older adult homelessness, and building a home care system that works for all Californians. So I'm going to just touch on a couple items since we last met. On the equity front, we've had some meetings with members of the Impact Committee and our other stakeholder groups, including our Equity Advisory Committee, about an MPA equity framework. So I want to thank Ross Lallian on our team for his work there, and that's a continued work in progress that we'll be bringing back to you. We also are so proud that we launched the LGBTQIA plus survey earlier this month, and it is now open and active through March. So we invite you to help us promote this survey. We were honored to present the survey, provided an advance release in person to the legislature's LGBTQ caucus, where it was warmly received, and we're thrilled to have legislators supporting the promotion of the survey. It's just been up for a little over a week, and we've already had close to 1,300 responses. Our goal is to have at least 2,000, so we really could use your help in getting the survey out. On the housing front, we held an event in October in Los Angeles, a statewide event. Some of you were part of that. The Preventing and Ending Older Adult Homelessness roundtable discussion. And we have the proceedings of that day will be shared out next month. So we're putting the final touches on that report. That also led to a presentation on the topic with the Interagency Council on Homelessness. At their last meeting, there was a focused discussion on older adult housing and homelessness, and it was a catalyst for our application to CMS, the Centers for Medicare and Medicaid Services, for a housing accelerator lab in partnership with the Administration for Community Living. And we expect to hear word on that. It would be a big win for California if we're selected for that. We hope to hear next week. So those are some activities. We also want to thank our generous foundation partners. We will be able to bring on some housing expertise to the Department of Aging soon to work with us to take advantage of these opportunities in these many settings. And I want to give a shout out to our partners at the Department of Rehabilitation, DOR, who have organized a TA session with the local housing and homeless continuums of care to help educate them on the needs of older adults and people with disabilities. And then last, but certainly not least, in the third bullet, as I see it, after equity and housing, would be a home care system that works for all. And the way that we see that has been in our long-term services and supports system change work. So I'm going to turn the spotlight over to Sarah Steenhausen now, our Deputy Director, who will walk us through the LTSS system change framework. Sarah.
Great. Well, thank you so much, Susan. It's wonderful to be here. And thank you to all of our members of the committee who consistently provide us with such critical feedback and input as we advance the master plan for aging. As Susan said, I'm going to walk through the 4 key kind of bucket areas of LTSS, long-term services and support system change, that we are focusing on in our master plan for aging implementation. We hope that this can help spur your thinking as you engage in your discussion today, thinking about the priorities that you want to elevate to us as we move forward. So moving forward with that, I'm going to walk through each of these at a very high level. And of course, please let us know if you have any questions. You may have seen this slide. This is how we're really trying to message and frame our LTSS system change work. This was really grounded in the report that was written by the Long-Term Services and Support Subcommittee that was helped provide input into the development of the Master Plan for Aging. So their report that was released and presented to the administration prior to the Master Plan's launch really helped frame a lot of the work that we're doing now. So just to think about the system change issues, starting with navigation. I know it's no surprise to anybody on this webinar that for older adults, people with disabilities, and family caregivers, it's extremely difficult to find and the information that and support that is needed to navigate and access services. So this is really framing a big component of our system change initiatives, where we're doubling down on trying to plan for and build out a no wrong door system that includes a consumer-facing web portal and contact center as a streamlined way to get support to individuals looking for information and services. We are in the early stages of this, but really excited to be doing that critical planning work, which also builds off the work of our Aging and Disability Resource Connection program that is a part of the system and critical to our local providers as well as consumers. I want to now move on to the issue of access, because even if we develop a very streamlined system of information and navigation, we know that not all of our home and community-based services are available throughout the state. So maybe there's areas that are more service deserts, or you might have other areas that have a breadth of services, but they might have long wait lists. But we've never really taken a system-wide look at the access issues. And so we're very pleased to be working in partnership with our Department of Healthcare Services in a two-part analysis of our home and community-based services system that looks at both Medi-Cal and non-Medi-Cal home and community-based services. And in partnership with Mathematica, we will be releasing a report that details where home and community-based services are available throughout the state and does a deep dive into kind of the demographics of the population and where the needs are and where the gaps are. From that, a roadmap will be developed to provide a framework for how we might build out access to this critical infrastructure. I also want to really point to the California 2030 efforts, which is really addressing issues of navigation and access. One of the key initiatives in the Master Plan for Aging is to focus on, easing consumer navigation and streamlining state and local structures by examining our network of area agencies on aging and making recommendations on how the area agencies on aging are governed, what the geographic boundaries look like, funding opportunities, core services, performance measures, and shared marketing and branding. Our aging network is really critical to realizing the goals of our LTSS system change work. So we're really proud that after a year of intensive stakeholder engagement, the California 2030 Steering Committee released their final report last week. We're really, really proud of the final report and eager to get started on these recommendations that were set forth by the Stakeholder Steering Committee. So CDA itself is looking at all the recommendations the Steering Committee developed. We're developing our own priorities as well as a work plan and timeline. There's a webinar on January 30th next week. We can put the link up to register if you're interested in learning more. And to that end, on a related note, I think that we're in a really special space where we have tremendous leadership from our Health and Human Services Agency, who, of course, you'll hear from Undersecretary Marco Meach in just a bit. But we're really pleased that in releasing the California Health and Human Services Priorities document this week, the California Health and Human Services Agency did identify the Area Agency on Aging Network System Change Initiative as one of the agency's top 4 priorities this year. So again, I think this just calls to attention both the emphasis on moving forward with our commitment to system change and how it's coming from all levels of government. So on to the third bucket of LTSS system change. Even if we address issues of navigation and have a very streamlined way to get access to information that everybody knows about, and if we build out access to programs and services on a statewide basis, we still have a tremendous challenge with our workforce. And this is why it's one of the key bold goals in the Master Plan for Aging. Specifically, we are focusing in on the direct care workforce through the Master Plan for Aging, both the paid direct care workforce that provides such critical services to older adults, people with disabilities in the home and in the community, but also the real backbone of our long-term services and support system, which is our family caregivers. So there's a number of initiatives underway in the Health and Human Services Agency, as well as through the Labor and Workforce Development Agency, to build the workforce pipeline, to launch initiatives such as Cal Grows and the in-home supportive services career pathway programs that provide training, stipends, and incentives to help the direct care workforce get the tools that they need to do their jobs successfully. And then finally, of course, a key component to building out our workforce is addressing issues of wages and benefits, which is a much broader system change component. Finally, in the fourth bucket of system change, we're looking at the issue of long-term services and supports financing. So clearly, even if we've addressed these 3 other critical areas, we know that older adults, people with disabilities, and family caregivers are really struggling to find ways to afford the cost of long-term services and supports. So there's a number of efforts underway to look at the financing of the system, including a report that was released by the Department of Insurance's Long-Term Care Insurance Task Force that looks at the feasibility and actuaries of establishing a state long-term services and supports public benefit. Second, the Department of Aging is really proud to be launching a long-term services and supports financing and affordability initiative, which will be over the next 2 years, we are going to be embarking on extensive research into the policy options across both Medicare and Medi-Cal on how we may address this issue of long-term services and supports financing and affordability by looking at a multitude of pathways forward. So I will stop there. That is a very high-level overview of our system change initiatives. And Susan, I'll hand it back to you to see if you want to add anything in.
Great. So we can take that slide down and pause here for any questions, comments, observations from our committee members. And we can show, great, we can show the full screen. Wonderful, wonderful. So I will look to see if we have any.
I'm attempting, this is Nancy McPherson, I'm attempting to raise my hand and that feature isn't working.
Uh-oh.
I would like to comment.
Thank you for raising your voice instead. Please, we'll start with you, Nancy, and we'll figure out what's happening.
Sarah, this is really an inspiring look at what change could actually be and what change is actually underway. One element that's missing for me is public education, because I think there is a real need to make a strong business case to the public and to the legislature and legislators individually for system change. I think folks who are going to be impacted by this and may need to raise their voices need to understand the current reality of the cost burden of long-term care and the changes that are underway, which I think could be very inspiring to the public to know how systematically this is being analyzed and what changes are being implemented. So I would ask for consideration for that.
Thank you, Nancy. Excellent point, and you're a key partner in that. So we will lean into AARP and others on that suggestion. Thank you. It looks like Kevin has his hand raised. Kevin?
Yeah, thanks for the great presentations to start the meeting off today. And thanks for development of the report. I've got a lot of background noise here. Can you hear me okay? Okay. Thanks for the development of the annual report. We look forward to digging into that and delivering a response as we have the last couple of years. So thanks for all that. I have questions about two separate items. So I'll start with one and then I'll see if others have questions and then maybe you can come back to me for the other. But the first is around housing. So Susan, I appreciate you highlighting some of the recent work that has happened on housing. I know when we talk about the budget later today, our group has some concerns and questions about some of the housing investments from the past and what's happening with those in the proposed budget moving forward and how older adults will be impacted in particular. But I wanted to highlight an initiative in particular, initiative number 2 in the current batches of initiatives was about exploring emerging local government models to inform consideration of rental subsidy programs. And the initiative committed to identifying existing program parameters and then doing some analysis of effectiveness to inform, again, further work. And I just recently was disappointed to learn that no progress has been made on that initiative to date. I think the agency that was responsible was BCSH, and we haven't seen them do anything to get engaged in this initiative. This has been a big priority. The Impact Committee has talked about rental subsidy programs, and I think each of our last annual reports, the commitment here was not terribly significant. It wasn't to actually start a subsidy program, but just rather to evaluate. So it's disappointing to see what seems like a pretty important step on a priority item we'd identified, but still a modest one that didn't require a big budget commitment or rolling out of a new program. To not see that move forward, I think, is disappointing. So we'd love to see progress on that initiative, and then also to hear from you how we as stakeholders might be able to, better engage with the broad array of agencies that touch housing programs for older adults to make sure that agencies like BCSH are actively thinking about aging and older adults and moving forward on these initiatives, but also engaging more broadly in any opportunity they have to be working to address housing needs for older people.
Thanks. Thank you for that, Kevin. So a couple thoughts, and then Sarah, please add in. I can say that BCSH, the Business Consumer Services and Housing Agency, has been a fantastic partner, and there's been a lot of discussion about the temporary rental assistance and rental subsidy programs. One example is a delegation visited Stanislaus County, where they have one of the model programs, and we met on the ground to learn more about how their program works. The topic also surfaced in our Preventing and Ending Older Adult Homelessness roundtable session, where something that's being explored right now is many local jurisdictions have introduced this using a wide variety of funding sources. So right now we're trying to assess the multitude of we uncovered that it's happening in a lot of areas organically, and we're now researching how that's happening, why that's happening. We've already seen some expansion in San Diego. Many jurisdictions have used existing revenue streams to make rental subsidies and temporary rental assistance available. So that the work is happening. You may not have see. So Sarah can talk a little bit more about it. We're also, really, really proud of the Department of Healthcare Services and their proposal to CMS to expand rental assistance under Medi-Cal, and we're hoping that will be fruitful for California as another avenue as well. Sarah, if you'd like to add.
Yeah, thank you so much, Susan. And I will say first, Kevin, thank you for elevating such a critical issue. Clearly, we've learned through a lot of our engagements that so much of the challenge facing older adults in terms of the risk of homelessness is related to the heavy reliance on renters and the increases in rents and affordability, and so many people ending up, risking their ability to stay in homes because of the cost that it incurred on them as rents increase. To that end, I will say, just to kind of expand on what Susan was saying, we have had incredible partnership from the Business Consumer Services and Housing Agency. Attending the conference that we put together in Southern California, focusing on older adult homelessness, as well as key partners on the All Inside initiative that we are part of with them, and engaging in several discussions about what we have learned about the older adult rental subsidies programs. I think where some of the challenge has come in with this particular initiative, number 2, is we developed it as an initiative to explore what we're learning from the local rental subsidy program. So I think that there might have been some misunderstanding that explore meant develop a report. And to that end, there were no resources put forward to do that. But we agree that it would be very helpful to have an analysis of the different programs and the different approaches to this across the state. So we're really proud to be able to work with our foundation partners, and we're seeking resources to do an in-depth analysis, and we'll absolutely be continuing to engage our Business Consumer Services and Housing Agency partners on that initiative. I also want to point to what Susan talked about. We applied with Health and Human Services Agency and Business Consumer Services and Housing Agency for a grant for technical assistance from the federal government for a housing and services partnership accelerator. And we're very hopeful that that it will be announced next week. And we're very hopeful that California will fare well in that. And be one of the states awarded. So I hear you, and I understand the desire to see movement on this. And I can say that in terms of the commitment to initiative number 2, we will get there in terms of developing a kind of more, comprehensive analysis that people can review of the different programs and services.
Thanks, Sarah, for that. I'm not seeing other hands raised, and we're joined now by Kim McCoy-Wade, Governor Newsom's Senior Advisor on Aging, Disability, and Alzheimer's. Kim, welcome.
Thank you. Thank you. And I'm actually glad I heard that question. I'll add in a little bit too about our cabinet level conversations about housing in this budget crisis time. But first of all, oh, look, there's a slide with my name on it. That's me. Good to see you all. Happy New Year, if it's okay to say that this late in the month. Boy, oh boy, here in the governor's office, we see the Little Hoover Commission coming out. We see the 3rd annual report to the legislature coming out. And of course, great unified stakeholder letters with budget requests and budget response. So thank you for all of the activity to kick off the year on where we've been with Little Hoover, where we need to go in the report, and where there's more to do, obviously. So really, really appreciate all of the continued work together to move these mountains. Can you take that slide down or just shrink it or something? I don't think people need to, or there we go. All right. So I mean, obviously where we're focused this year with the budget picture is, keeping our promises and protecting. I mean, here we are in January, and SSP grants went up in January. I think the SSI Coalition told me this week we're now at back to 96% of the federal poverty. So not there yet, but, recovered from the cuts in 2009, on the way to recovering from the cuts from 20 years ago. So I'm thrilled that SSP went through. And first in the nation, dropping of the asset test in Medicaid for aging and disabled folks. So 2 historical things are happening in January, despite the budget situation we're in that is not good and looking not better for May at this point. So we are focused on implementation, like the 2 things I just mentioned. Just got to sign off on the terrific Alzheimer's PSA campaign that's about to roll out, one of the 9 task force initiatives. So many, many other things that I'm not going to recite them all, but many things continue to roll out from the historic investments of the last couple budgets, of course. We're also really looking at federal opportunities, so I'll talk more about that in a second. We've got a good partner in Washington right now, and we want to leverage that. They've been very helpful on the Medicaid side, so are there things we could do on the Medicare side in California to lead the way, continue to lead our way in healthcare? But I would say, you know, where we are really focused, and I think I saw on the agenda, is about the systems. This is we're year 4 of our master plan. We're in a tough budget year. We're in the governor's last 3 years. So it's a really foundational year in some ways, if that makes sense. And I think you see that in 3 proposals. One, to modernize our aging services network based on the Aging 2030 work. We're going to really take a hard look at the accountability and equity in that system. Same, you probably have seen the master plan for developmental disabilities, taking the same approach and looking at person-centered. What are the opportunities for just people with developmental disabilities to live in the community, to work, to age well in the community? And then thirdly, working with Department of Rehabilitation as part of the governor's master plan. You see, we started something here with master plan on career education to make sure that at the lifespan initiative, that career education happens throughout your life, and that it is fully inclusive of the diversity of disabilities. So these are system reforms that are happening in our 3, the Aging Services Network, the Developmental Disabilities Network, and the Department of Rehabilitation Employment and Career Services Network that are kicking off. And I'm really thankful to Secretary Galley and all the directors for their leadership. And that's going to be super important work to plug into. And then I also want to say we are really looking at what does year 4 of the cabinet work group look like. We are talking with Secretary Galley about things like the fact that we have new secretaries in a lot of places. I hope we've talked about Secretary Tamika Moss over at starting next month on housing, who brings a big, strong background in homelessness in the Bay Area, and particularly with older adults. So for example, when the budget picture became clear that a lot of housing and homelessness was really taking a lot of the brunt of the proposed cuts in the budget, we did huddle with Bish and said, what are we going to do to continue to make progress in addition to implementation? And so we have discussed with them some of the things they're continuing to work on. One is there are infrastructure opportunities, infrastructure funding for housing. People don't hear about that. You think it's all high-speed rail and broadband, but there are significant housing opportunities that we're working closely with Sasha and Melinda Grant there and the team to identify. They're also doing, this may be more localized, but housing preservation. They have they blocked the closing of a affordable senior housing project in San Luis Obispo as against the county's housing accountability. So their housing accountability unit is protecting some senior housing from developers. And they're also deeply engaged with our state's general plan and housing plan, which is outdated in how we think about housing for older adults. And so they are doing a lot of system work themselves. So I share that story just to say, the work continues and it will be in different ways. And one of our challenges is to make sure we do that with your input, with your collaboration, as much transparency as we can as we work on those administrative actions. Just one more that we're working on, we were really pleased to convene CalHHS leadership and CDCR leadership to talk about how older adults are transitioning home from prison. We have a significant number of older adults. It's the only growing population in prison. Many have dementia and other disabilities, and returning home to the community and to family is a challenge for the CDCR system. So we are working through that as well. And there's other examples, but again, I hope we can come back to you at a future meeting that Susan and I can share kind of the Cabinet Work Group 2024 plan, and meanwhile invite your input. As you may remember, year 1 we worked with secretaries on strategy, year 2 we worked with undersecretaries on implementation, and year 3 we worked with leaders on training and aging policy and aging data and ageism. So year 4, where do we go from here aside from these focused initiatives that we know we want to continue to drive? So wish we had better news on budget, but frankly, those of us who were around 20 years ago are grateful for what didn't happen, even as we're still raising our voices about what needs to happen and looking really excited about the time to do the system work that will power us to 2030 and beyond. I'm
Thank
happy
you,
to pass the
Kim.
mic back or take any questions or comments anytime.
Yes, if you've got the time, I'd love to open it up to our impact committee members, and the hand feature's working. So we've got Kevin, and then we've got Nancy and others. If you'd like to speak, please raise your hands. And Kim, you just field the questions. I'm gonna, you
Okay,
just handle
unless they're for you.
Yeah.
Okay, thanks.
Since I just spoke, I'm happy to go to the back of this line and let Nancy and Linda get in here first.
Yeah, and I'm happy to have Linda go first since I spoke too.
Love it. Linda, we'll start with
Thank you for allowing me to go first. And firstly, do want to thank the administration for honoring those past commitments, particularly the elimination of the asset test and maintaining the SSI grants, although, as you know, this is still below the poverty level. So look forward to working with the administrations on ways to increase this. Also, just want to urge timely implementation of the share of cost reform that was in the 2020 in last year's budget that is supposed to take into effect in 2025. We know that many of our low-income seniors and persons with disabilities are desperately waiting for this reform. As right now they're expected to pay over $1,000 before they can actually access Medi-Cal, and just we know in terms of affordability, living off of $600 a month is just not is not something that you can do in California. And I know some of the others who have their hand raised will talk more in depth about the housing, and so we'll pass it to them, but also share their concerns.
Yeah, and I want to acknowledge that we received the letter. I think it was signed by 70 groups in the aging, disability, and health community on share of costs, and Justice and Aging led a briefing of our cabinet and ledge teams here. So I think before the budget was released even. So that is squarely on our agenda at every level. So thank you. On our radar at every level, I should say. Okay, I'll let Nancy and Kevin duke it out.
I'll go next because I spoke up first. So Kim, really appreciate hearing the work that's going on with the cabinet work group, and particularly with systems changed. It's always a concern about how the baton gets passed from a previous incumbent to new leadership. I would like to encourage a way to also onboard mid-managers and first-line supervisors in these agencies who are responsible actually for the execution of systems change and for making sure that happens with frontline workers.
Great idea.
And it could be a video, it could be, you don't have to spend a ton of money on bringing people to training, but some way to send a really clear message and reinforce the change that's occurring and the commitment that's expected from people who lead at those levels. Nancy,
that's a terrific idea. Yes, we'll do that. I love that idea, because that is one of our challenges in our large and complex government and there was probably have it from clips from the launch and from the forum, but you're absolutely right to share that energy and enthusiasm all the way through the system is a really great idea. We can figure out how to do that. Thank you.
Yeah, and I just wanted to chime in as well, Kim, to thank you for the excellent presentation, to thank you and the governor and the whole team there for presenting a budget that did avoid significant cuts to services for older adults. Just to be on the record, we've lived through the times where often services for older people and people with disabilities were among the first to be cut, and oftentimes proposed deep and severe cuts. And so even though we understand that the state is in a difficult budget position, to see that continued commitment to those services was a relief and a welcome sign. And we know that the whole story of this budget hasn't been written yet.
Thank you. This is the January proposal, and everyone's coming in now. So yeah, long way between May and June. Yeah.
So we look forward to continuing to work with you to make sure that everybody's fully aware of just how important these services are in the community, and to hopefully to help ensure those commitments. And then really appreciate you highlighting some of the places where there were even expansions recently or returns of previous
Yeah.
benefits, like the SSI, and the asset test elimination. And thank you, Linda, for highlighting the work that needs to be done on the sheriff cost reform. So that's all wonderful, and we really appreciate all that. As we've been talking so far today about systems change, and had wonderful presentation from Sarah about the framework for advancing our LTSS system. You know, the other budget crisis that's happening in families is the crisis of affording long-term care. And as this whole process began, the master plan for aging, understanding the demographics of the state and seeing the increased impacts of families of the cost of long-term care, that's a crisis that's playing out every day around kitchen tables, as families have new needs and are trying to figure out how to cover them. And they're seeing their savings depleted, they're seeing their options unavailable, they're going without care, and it's having, you know, generational impacts on families. So my, I guess, question / concern here is we are in a different budget time, but families are in the same budget time. We still have not provided an answer to families about how to afford this care going forward. So how do we find the courage, find the energy, find the focus to look beyond the current picture, and think to those deep system problems that the governor started us on this path of? How do we find the revenue as a state to support this growing need? And there was a lot of comments made by the governor that I don't think were explicitly focused on the long-term care crisis, but that were very negative about the opportunities to raise additional revenue in the state. And as someone who's dealt with these challenges with communities for a long time, I couldn't help but hear that as disappointing, that the governor didn't sound open to thinking about how we can get creative about raising revenue to support this need in our community. So I don't want to put you on a spot to give us an answer, but
Yeah,
I want to kind of, what do you suggest to all of us about, even in a budget downturn, how we don't lose momentum to take big steps that are needed to support our communities?
So I absolutely believe the time to call for the affordability of care as a family table issue is now. And if the more we talk about LTSS financing, the more we leave out people who should and are with us. It's a kitchen table issue. I thought Sarita's column in Business, was in Forbes a few months ago, who really said this is the #1 affordability issue for families. It's now surpassing childcare, it's surpassing housing, it's surpassing healthcare. She really framed it as a family issue, as a, and so I think our work is to bring it into the family agenda and the affordability agenda, and not just be over by ourselves talking LTSS financing. So the first partner is all over the planet talking about the parents' agenda. Both the first partner and the governor, as you well know, were at the Clinton Global Initiative in September talking about caregiving, and at the CareFest, first CareFest in Los Angeles. So I think the more we see ourselves as part of the family care agenda, we will do better in connecting with every single person you meet on the street is struggling with this. So it's not that we have to educate people about the issue, we have to connect it to policy. On the budget issue, the administration's position is that we need to maximize all of our Medicaid dollars and maximize all of our Medicare dollars. And I think you see that on the Medicaid track, expanding access to home and community-based services through the undocumented expansion to older adults, the community services package, the enhanced care managers package, the dropping of the asset test. All of that is about squeezing all the home and community care we can out of the Medicaid system. Obviously, share of cost is part of that discussion as well. And then I think we're really looking at the Medicare options. I know Secretary Galley and Marco, with his federal background, are really interested in some innovative possibilities with the feds. We don't know what's possible. We don't know what's possible this year or next year. I think, and yes, you've read exactly right that that raising taxes is a last resort for the governor. He was pretty clear about that. So that's where that stands in terms of, and I think, you know, part of that is the, you know, payroll tax, wealth tax, the source has different issues as well. But at this point, I think we're not really looking at that. We're looking at Medicaid and Medicare, but none of that should stop people from raising the need from the rooftops, because it's absolutely everything you said in terms of disparate impacts on families, generational impact on the next generation, impact on women's working and women's retirement and women's economic security. So these are all the issues we just have not come to the movement on family affordability that the governor and the first partner is leading as deeply as I would like us to. More to do.
All right, we've got Kieran and, oh no, we had Fernand. I don't know who came first.
Oh,
Toss a
Karen,
coin. Fernando and Kieran, you both.
Karen.
Kieran,
first.
please.
Kevin kind of got to it before me, so
You guys know you're the only meeting that does this. Every
then
other meeting,
Kathleen.
people are like throwing elbows to get ahead of each other. So thank you.
Kieran,
Thank you.
Fernando, Kathleen, take it away.
I was just saying, I think Kevin got to a lot of it before me. I was on the same wavelength, which I appreciate this year's budget. I think we appreciate from the healthcare perspective that there weren't deep cuts. We also appreciate going back to the federal government for more money with the MCO tax. Like, let's do that, right? Like, so we're all in for that. I do have, as we look at sort of the 3-year projection, I think we worry about what comes next year. And it felt like a lot of the balancing of the budget this year was a pretty short term in terms of like, we delay things, we pull down money from the federal government that we probably won't be able to do next year, right? And so I think the revenue question was high in our minds also as a real equity issue. And I understand, we bring in a lot of our revenue as a state from high income earners, but it's still a very disparate impact when you look at how much their wealth is growing and how much people, most of us and people at the bottom are really struggling. And when you talk about those SSI, SSP levels still not being up to nearly where they need to be. And so I guess it's not, I think you've answered the question, but I just want to put in my voice too, that I think if we're really serious about equity in this state across issues, including for older adults and people with disabilities, we've got to look at sort of economic inequality and how we are bringing more revenue into the state in a way that supports the people that provide the work and the labor that makes California the place that it is. So I appreciate that.
Well, and I really appreciate you framing it as as probably a 3-year conversation. This is where we are now, given the 2024 budget picture and situation. But you're right, it's a 3-year conversation for sure. Did you say Fernando was next? Okay.
I think so. Yes, 2 quick issues. First on the housing, the unhoused, and the crises facing that area. I appreciate the explanation on the rental subsidy that you all are trying to get a sense of what's happening at the local level, what are others doing. I just hope that at the very least, I think as Kevin has reinforced, we keep that issue high in terms of visibility, that we need to come up with a statewide rental subsidy program and building on whatever municipalities like San Diego are attempting to do. So I'd like to reinforce that. On long-term care, and of course, always learn a lot from Sarah's presentation and that schematic chart, and also regarding, how we highlight this issue. I think Nancy's brought that out. There is a narrow segment of caregivers and those facing the caregiving crisis, and those are individuals with long-term care insurance, private long-term care insurance. Increasingly, what I'm hearing from a lot of my friends and family members who purchased private long-term care insurance over the years, including CalPERS, they're getting squeezed. They're getting squeezed by the few remaining insurance companies. The premiums are going up, et cetera, et cetera, et cetera, and really forcing more and more of individuals who planned ahead, were proactive to buy private long-term care insurance, to either scale it back or give it up altogether. I raise that only because it is a fairly narrow segment of our constituency, but I believe they're perhaps one of the most articulate, influential segments of the caregiving community because they were smart enough to buy it way back when. Now they're feeling squeezed by it. So, Sarah, perhaps this is a question to you. Have you been monitoring the developments in the private long-term care insurance market? And then secondly, how can we capture that anxiety to support our larger goals of keeping caregiving front and center as we work on these various system approaches?
Sure. Well, thank you, Fernando. Thank you for your excellent question and just really important insight into the real challenges people are facing right now with long-term care financing. In terms of the specifics on issues impacting the long-term care insurance market, I would say that right now our focus, we were part of the advisors, technical advisors to the Department of Insurance's long-term care insurance task force, but we were not official members in the sense that we didn't weigh in on it. And so in the sense of being aware of the challenges facing the industry, absolutely so. And I think what we're really trying to do right now is utilize the resources that were given to us through the budget in 2022 to focus on a comprehensive look at a range of policy options across Medicare, Medi-Cal, and the continuum that can help us develop, a range of solutions for the various parts of the population. And this will include, understanding the needs of our existing missing middle population, which can go all the way up to 800% of federal poverty level. So there's a big range of people that fall in that missing middle, and we really need to think carefully about how to understand the needs of that population, project out, and then really target solutions across the population. So I would say that all of it's important to think about the role of public and private, and that's where we are right now. And I think we will have opportunity to discuss more what the specifics of that look like. Kim or Susan, do you want to add into that?
No, I think you covered it beautifully. I mean, again, the insurance commissioner has just finished their work on the need. And so there may be some follow-up that could happen in conversation with the insurance commissioner on what they plan to do in their lane.
Kathleen.
Hi, thank you. This has been a wonderful meeting so far. Thank you, Sarah and Kim, for your presentations. And I really appreciate my committee members for also bringing up great points. I wanted to highlight one thing that just came up for me when we were talking about access to long-term care, because it does seem to evolve around cost, obviously, location, particularly for those of us who live in rural areas. I think we also need to think a little bit more about perhaps language, and that we have found that some folks who do not speak English as first language do not have access to care simply because they can't cross that barrier of language. And then, in the discussion around family, and I'm a provider at a small nonprofit in San Francisco, we work with people who don't have family.
Right.
And so nonprofits then become the safety net, and staff is asked to perform what family members normally would. And then there's a whole, training that we have to do for our staff. But I do just feel that we need to be a little sensitive to the fact that there are just some people who don't have, they don't have the benefit of family. And I think we'll learn more. And Susan highlighted it, that we have embarked on the first ever study of the LGBTQI aging experience. So we're going to learn a lot over the next several months, and perhaps that could be reflected back in some of the thoughts in terms of how we craft the initiatives around access to care.
Yeah, absolutely. I mean, I think that is in part, there's no one answer to what you just said, but I think what you did say is in part the concept behind enhanced care management as a benefit in Medi-Cal. And so one of the sort of questions is, could you become an enhanced care management provider, and you're in a network and maybe have a specialty in serving LGBT, and how would you partner with Medicaid health plans across the state even to be the best in class, to be an intermediary to your peers and all the other. So someone handles the big bad Medicaid and health plan contracts, but then you're getting paid to do enhanced care management, which in many ways is obviously a skill, and also a lot of those family caregiving and care coordination tasks. So one thought about that. But I do also want to come back on the housing pieces. Just to reiterate, the issues you've raised last year continue to be our top of mind issues. Home and community-based care, housing, and mental health are just the top of the line issues. On some of the questions I have for the group in a tight budget are, we've done a lot on renter protections, on mobile home protections, on housing accountability protections. So if you see gaps for older and disabled adults, and there's more to do on a policy to prevent skyrocketing rents and prevent discretionary evictions, please let us know. Those kinds of protections are welcome. And the other thing that I continue, and maybe we could have a follow-up meeting is I'm very curious about the SSP non-medical out-of-home care rate, which is really what keeps our small 6 beds afloat in providing housing and support with the activities of daily living. And while we've made progress on SSP, we need the feds to make progress on SSI. If we really want to identify these small 6 beds, and they need a better name than that, or small RCFEs, then we think we need to look at that rate, because it is the primary way that Medicaid folks who are going to pay their rent and pay for care. So that's on my mind too, is what we could do about baking it into a licensed care place, a place that has care, a place that would not be able to jack rents in the same way. So look forward to more thinking about both general renter protections and then our Medicaid levers and other rate levers.
Thanks for that. And Kathleen, I just want to, you reminded me of, we did not mention the governor's commitment in this budget to the $50 million older adult behavioral health funding that's really intended to reach CBOs like you. You were actually a key partner in the listening sessions in the San Francisco event with your staff. So that remained intact in the budget, and we're incredibly grateful. Not to mention the other efforts on the behavioral health continuum that continue, and the modernization efforts that are in play, and the ballot initiative in the spring. So lots happening on the behavioral health side that we didn't get to. We want to hear next from,
you've also, you remembered and reminded that there's also on the housing front, Little Hoover is doing a second report on housing and homelessness coming out this spring. So again, top of mind work continues.
Yep, and putting a focus that has not previously existed on this population as it relates to housing. Thank you, Kim. We'll hear from Sharon and then Sarita, please.
Hi, good morning. And Kim, I just want to thank you for your comments regarding housing preservation. And I wanted to kind of ask a question regarding something that you mentioned relative to your work with CDCR and the growing population that's incarcerated. It's really refreshing to hear that there is some attention that's being geared in that direction, given the new laws that's been promulgated that impact the realignment population that's returning to the local communities who are in dire need of housing. So I just kind of wanted to hear a little bit more about that, and to kind of see what type of discussions are ensuing about that, knowing that with recent laws with those that have substance use disorder and behavioral health issues, we're now going to see more individuals returning back to the local communities with housing needs that we have to position ourselves to address. So can you?
I will do a 1-minute version, but I would love to do a follow-up, because first of all, you're reminding me when we met, 3 counties are receiving the majority of older adults leaving prison, and San Bernardino, along with LA and San Diego, are the big 3. And really, it's looking at the fact that the reentry system is not geared towards age, disability, and dementia. The reentry system was built in a different time. And our PATH initiative through Medicaid is really working hard. So we've just, with CDCR, to figure out not just the jail partnership, but the prison partnership, we're working through some barriers around the full gamut of placements, going back family support, like you do in foster care reunification, right? Finding the kinship circle, supporting IHSS, counseling, trauma, healing, looking at RCFEs or 6 beds that would be particularly interested and skilled at serving this population, whether or not they're on probation or not, but and including the dementia and the trauma and other issues that might be there. And then working through some knots with our nursing homes about how they can serve people who may be on parole or not, which they absolutely can, and working through some stigma and education and safety issues with them. So we're looking kind of at all the different placement paths, and really, how do we make sure that CDCR does its work on that? It has transition money, transition housing, transition budgets, and then the counties and the health plans play their appropriate roles too. So I think I know more to come. We have a terrific geriatrician from the CDCR hospital system participating in the CalAIM work group on justice involved, and did a terrific briefing on data. And so we get, it's a big number, but it's a number we can handle. It's not, so we, I think that's a great idea. Let me talk with you and Laura and the right person at San Diego. I know Kim has a new job now, but that would be a great thing when the time is right to do a briefing, particularly about where we're going with that, because there's a lot. And also I should just say, compassionate release just changed. You may know that, so that it's a longer trajectory of when people can be released. And so that's also increasing the number of people coming out on a shorter timeline and needing hospice or other kind of palliative care. So never a dull moment, but thank you for your interest. I'll follow up with you.
Thank you, Kim.
Sarita.
Dr. Mohanty.
Hey, good morning. So thank you so much. I just want to echo all the positive feedback comments that I heard from my Impact Committee members. And I just want to say, I mean, just more of a plug and maybe a quick question about the work. So, you know, I was when Kevin talked about the rental subsidies, and then Sarah, you mentioned that there were a lot of local or regional efforts happening, or I think maybe Susan was. It makes me realize that, you know, we have such opportunity to elevate some of the best practices that are happening at the local level. And I just want to reinforce, and I guess the role of the voices of the community, and really making sure as we're tracking the initiatives that we're elevating those stories, those experiences, because I think that is really important as we're trying to advance equitable aging in California. And so one of the things I know you would, I think in previous commission or Impact Committee meetings, we talked about, you know, your communication strategy for the MPA work. Can you talk a little bit more on kind of how you're thinking about, you know, showcasing some of those stories and those community voices in the work that's progressing with MPA?
I'll let Susan and her fabulous comms team take the lead on that question.
That's our favorite part of the work, Sarita. So a couple thoughts on that. So we've been doing some, we were fortunate to do some work with Lucas Public Affairs at the end of last year, and we're able to place some stories. You know, stepping back, I have never seen the volume or caliber of articles that I have seen on the very issues that we are talking about in this meeting today, not just older adults as a topic, but the real substantive issues featuring, you know, real life people in national publications, state publications. We track all of that at CDA, and, you know, Time Magazine, New York Times, LA Times, you know, San Francisco Chronicle, and, you know, local papers, our work with Ethnic Media Services, where, you know, tremendous story placement. Couple thoughts, you know, one is CDA is celebrating their 50th anniversary this year. So we do have we're modeling it on Justice and Aging's 50th anniversary. So we're featuring stories of real people and people who built this system, and, you know, whose shoulders we stand on today, to make sure that, you know, there's a human story. We're also really eager, and you'll hear from Jackie about our Day of Action in October, which is really an opportunity to put the lived experience front and center on an agenda in a way that we are not able to do on Zoom as impactfully. So that's, you know, absolutely something that we look forward to do. You know, I also want to commend the SCAN Foundation for your work, your equity work, Sarita, and the convening that you held, and the phenomenal videos and panels that were featured. We were, because of your generosity, when we had our Preventing and Ending Older Adult homelessness event in Los Angeles with about 100 people in attendance, you know, representing Business Consumer Services and Housing, Secretary Galley from HHS, our federal partners, we aired some of your video clips between segments, and they were very, very impactful. So we really look to our 6 stakeholder advisory committee to help. We're recruiting new members now to bring on different perspectives, more lived experience, people from other geographies. So where you can be helpful with that and helping us identify new members of our stakeholder groups.
Thank you.
Okay, and then I'll stop. This really is my favorite part of the work. Just yesterday, we previewed in a webinar the home and community-based services, the gap analysis and roadmap work that's being performed, and incredible report outs from the listening sessions. And I've never seen bar graphs like I saw in terms of the representation, who was invited and participated, and the perspectives that are informing that work. And then last piece, Sarah mentioned the California 2030, the final report and recommendations. We're very proud that we just concluded California's first statewide consumer survey. And we reached 17,000 households that completed the survey in all 58 counties. What we're most proud of is these are individuals, these were random household surveys. So it was clear from the survey, they don't touch our system. So instead of querying people who are already in our network and in our system, it was much more of a random survey. And we're really excited to share out those results later this spring.
Susan, I know we're way over time, so I'm gonna say thank you. And of course, I'm gonna have a request, because this is probably gonna be a busier bill year. All right, it's year 2 of a 2-year session, and then a budget year. Please let me know about bills before they get to the governor's desk. And I will help you connect with the right ledge deputy. I know many of you know the HHS team, but increasingly our bills are in voting, are in parks, are in employment, Commission on Aging, lifting up employment. So please get in here early. If you haven't already, we should hear your bill concepts, and we should be engaging so we can do technical assistance and see what's possible. All right, that was my request. Thank you for all this time. Continue to have a fabulous meeting and stay in good touch. Thank you.
Kim, thanks so much for joining us today. Thank you. So we're now on this, that sort of served 2 purposes. We wanted to make sure, I don't know if the Impact Committee members have organized any formal statements or items that you wanted to discuss. We wanted to allow time on the agenda. We now have Kieran, you've got your hand raised.
Sorry, I don't have any formal statements on behalf of the committee. But I was just sending Sarah a message because I apologize for being late. I did have a question about the annual report you sent us, which I don't know, is that okay for me to?
Yeah, this is a great time. We wanted to just have, a little downtime. If there aren't items, we can ask Jackie to talk about the day of action. But please, Karen, if you have questions about the annual report, let's hear them.
It was kind of an overarching question, but the thing that I noticed in reading it, first of all, great work. Love that you do an annual report. We would love to have that information from like every department. So it's really, really helpful that you do an annual report and keep track of it. I think this thing that stood out to me was there was no mention of the Impact Committee, which just kind of, I guess I had a question about, there's a section about accountability or oversight, there's a section about stakeholder involvement. And I guess I was just curious, like, is the role of this committee evolving? Like, how do you see it? Kind of, it was surprising to me. It's totally fine. It's not a criticism, but it just made me ask the question of sort of where do you see this group? How can we be most helpful in the broad sense around the work on the MPA?
Well, that's an oversight. I know there were mentions in our stakeholder work and the acknowledgements, but that's central to accountability. I think there was a section there. So that's a missed opportunity. And this is why we need more eyes and ears on our work and dialogue. These are things we can correct for in the future. It's a great segue, Kieran, to some conversations we had with Kevin. Given the Little Hoover Commission's oversight of the master plan and the recommendations that they released, and there is some talk about the impact committee. We thought your next meeting would be a really good time to sort of reset and pick your brains about the structure of the next 2 years of initiatives, any course corrections on the role, function, purpose of the impact committee, taking in their feedback. If it's unclear to you, boy, it's unclear to lots of people then. So let's be sure that we address that in the next. We see you as essential, and I'm sorry if that did not come through in the report.
No, again, no apology needed. I was just kind of curious. I was like, oh, is there something that we should know? And so I look forward to that next conversation. That sounds really productive. Yeah, thank you.
All right, any other general topics, comments, updates from any impact committee members? I'm not seeing any hands raised, in which case I will is Kira a member of the committee? Kira, I see your hand raised, and we have opportunity for public comment in the final 10 minutes of this agenda. Please stay with us until then. And now I'll invite Jackie to update the group on planning for the next day of action. Jackie.
Hi, everyone. I'm pretty sure I unmuted myself, so let me know if I'm not coming through clearly. Wow, what a wonderful dialogue. This got me so incredibly excited because I heard so many ideas, recommendations, and we're in a year where we are coming up with priority MPA recommendations for the next 2 years. And so thinking about all these ideas and recommendations are only going to make the next iteration of the Master Plan for Aging initiatives really grounded in our current needs, the current environment, and new information. I think there's a lot of beauty in our Master Plan for Aging itself being a living document in which we're able to revisit the initiatives every 2 years. I think it's also powerful that we have 5 bold goals that we're working towards to keep us focused, as well as the 23 strategies to keep us focused. But again, being able to revisit the priority initiatives every 2 years allows us to be flexible and responsive to changing information and needs. And we do design these initiatives in collaboration with Impact and the other MPA stakeholder committees. So I wanted to talk to you a little bit about the process for that this year, and specifically leading up to our MPA Day of Action, which we're looking to hold in October of 2024. Advance my own slide, not used to that. So just wanted to highlight just a few aims of our day of action for the Master Plan for Aging. Some of you might have been able to attend the event that was held in 2022. I actually was not able to attend as an in-person attendee, as I was with another department at the time, but knowing that the department I was with at the time focused also on aging and public health, it was important that I attended that event. So I'm very excited that I'll be able to attend this year. Looking at just kind of the key focus areas and aims for the event, it's really designed for us to continuously allow a platform for information and education, to inform and educate on current issues and emerging issues that we're seeing among the populations that we serve. And this information education needs to happen to diverse stakeholders, partners, and decision makers. This includes those of you with subject matter expertise on this call, but we also talked about during the course of today's call, the value of bringing in new people to our network as well, so we can continuously advance the Master Plan for Aging. So first goal for the event is to inform and educate. So this will be a time that we gather priority recommendations from the various MPA stakeholder committees to connect the issues and ideas that we're seeing in the community to direct policy, programmatic, and service recommendations. And again, these priority recommendations will then help inform the development of the MPA's initiatives for the next 2 years, so 25, 26. We also know as we get to this time next year, the master plan for aging will be basically at its like mid-year point, with it being 2025. So it's really important that we have some opportunities to, again, come together as an aging and disability services network with new people to have renewed commitments and accelerate our progress. It's important that we sustain what we have going, as well as build upon the initiative's progress and the commitments that we are making towards the 5 bold goals. And then lastly, it's really an opportunity for us to pull together diverse partners across various sectors, not only at our state leadership level, but California is a leader in this space. So this event itself is really also designed to elevate California as a model to some of our federal partners and some of our other state partners that are also working on master plans for aging. California has been really connected to a lot of other states who are starting to build out their own master plans. I think we're looking at over 25, we might even be at 28 states that are looking to do this work, and California is leading in this space. And also inviting our, we heard on this call the importance of elevating the community voices. I heard that from members of this committee. And so this is also an opportunity where we can hear from consumers, hear from providers, and hear from that local perspective. Again, just recognizing the diversity that we have here in California. So just wanted to share some of those key aims of what this event is really designed to do. Inform and educate, renew commitment and accelerate progress, and also engage partners in that whole of government approach. We also have some of our local counties and cities that are also developing their own master plans for aging. So that is very exciting that maybe they'll be able to partake as well. And so just in terms of logistics, if you weren't already aware, we're looking at hosting this event on Tuesday, October 8th, 2024. Fall time. We are doing this here at the Sacramento Convention Center with the time to be determined. But essentially, we just wanted to elevate and share this date with all of you now. We'll likely be able to do some save the date promotions and communications to ensure it's on everyone's calendar, but just wanted to flag this as an opportunity where we want Impact to elevate things that we heard in this call to the day of action. And then lastly, Susan briefly talked about it when we were talking about the importance of we do all this work, but how can we communicate it out? And so this kind of links to that segment of the discussion. We talked about how California itself is serving 50 years of partnerships and programs serving older adults here in California. And so in order to celebrate this milestone, there is an anniversary campaign that's called 50 Stories in 50 Years, where we're looking for people to share stories of how their lives have been positively impacted by the network of aging and disability services. And so we're really looking to you all as Impact members. If you feel like you have a story you want to share about your work, the outcomes of what you've seen here in California over the many decades in shaping and delivering aging services, we are inviting you to share a story with us. And on the screen, it does outline our communications colleagues' email address. Some of you might have already been in contact with them, but we wanted to further extend the invitation for you all to share your story, to make your mark, and again, share how you have worked on and how your community has benefited from this larger network. And so invite you to share an email with them. So with that, I think that was the end of my kind of promotion for the day of action, as well as the 50th year anniversary celebration. Happy to field any questions until Marco joins us at 11:30, or we can move into discussion as well.
Great, Jackie. Thank you so much. And Marco has joined us, so I'll just wrap on this topic. Two things as impact committee members. There will be a process where you develop substantive policy recommendations for the day of action, and we'll work with you on that. But if you have any suggestions as a group as to how the day is structured, presenters, you know, theme formatting, we'd love to hear from you as a collective on that too. So please help inform the work while we're in the early planning stages. And then I just wanted to thank our generous foundation partners who are making the day of action possible. This is not a CDA or state-sponsored activity. It is made possible solely by the generosity of our Master Plan for Aging funders. So thank you. Sarita, I know you're off screen, but I hope your ears are open to hear that and pass it along to your foundation colleagues. And now it's my pleasure to welcome our Undersecretary in the California Health and Human Services Agency, Marco Meach, who is joining us now. Marco, welcome.
Thanks, Susan, and hi, everybody. It's been a minute since I've had a chance to connect with all of you. I've obviously had an opportunity to connect with some of you individually, and it's wonderful to see all of you. Happy New Year. Last time I spoke with you, it's been probably a while. My wife and I have a 10-month-old now since the last time we spoke, and I have a 5.5-year-old who's going on to 15. He runs the household. And I think some of you are in similar boats. We also are, just like many of you on the Zoom, are in the midst of being parents to young kiddos and then have older parents who are aging. And so we are having to also navigate various issues on that front. Spent a lot of time actually yesterday with my wife's uncle, who is having trouble getting onto Medicare, and Sarah knows she's been providing me technical assistance on this, but it's, you know, it is real. And so just wanted to thank you to all of you for the work that you do each and every day. It certainly is important. I just wanted to step in and just both have an opportunity to hear from all of you, kind of the things that are top of mind for each of you as we both embark on this budget, but also our broader policy and programmatic work. I also wanted to spend a little bit of time just giving you a glimpse into kind of how the Secretary has begun to shape our thinking and our work going into the first quarter of 2024, so that you have some insights into how we think about this across the board. First, I think the year 3 report is coming out, or is out, and I just cannot be more proud of where we are. I vividly remember the meeting that we had in the CAP office back then, when the governor first took office, when we started to chart a path for us doing this, and I could have never imagined us being where we are today. And as a result, now we have a master plan for kids' mental health and a master plan for early learning and care. And we just announced a master plan for developmental services. I think it's because the crazy success of this work and the way we've come together as a community, and the fact that this isn't just driven by state, it's really driven by you all, I think is an important piece to what we're here. And then to Jackie's point earlier around the fact that other states are joining in this movement, I actually just got off a phone call with the Aspen Institute, where I'm part of a cohort of undersecretaries from across the country. And it was really interesting to hear kind of the interest in some of the space and what folks are doing to push the needle. So really proud of the leadership that you all have embarked on. On the budget front, really quickly, I want to start by just saying that despite the fact that, we are in a difficult situation on the budget front, I think it's also equally important to recognize kind of the fact that families are struggling too, right, to make ends meet, and are struggling to figure out how to patch together the appropriate services for their loved ones. I alluded to the situation with my uncle, or my wife's uncle in particular, Over the weekend, I had a colleague call me. He is a caregiver to his 82-year-old aunt, who ended up falling in her apartment, and they didn't find her. It was a day and a half. She was on the floor before they found her. Luckily, they were able to make it to the hospital. She's okay. And now they're looking at skilled nursing care. She is not dually eligible, but only lives off of her Social Security. And my colleague said to me, I don't know how we're going to do this. My wife and I can't afford to continue to support her. I look at the various assisted living facilities or other places that are of quality. They're just really expensive, and I cannot afford it. And I could just hear he was on the brink of tears because he did not know what to do. And so his story is, I don't think, unique, or I believe it's not unique. You guys should tell me whether that's not true. But I think more and more people are finding themselves in that spot. And so I think despite where we are with the budget, there's a lot more that we need to do, and we recognize that we need to do to think about how we further support older individuals and people with disabilities in the community to have the right services and supports with dignity and with respect. And I do worry about many more people who are in what I call the middle class that is shrinking by the day, who are not going to be able to afford to do the things. There was a Pew article that I read recently. My parents' generation could make ends meet on a salary of $80,000. Today, my parents would need to be making $250,000 a year to kind of have that same quality of life that they did 20 years ago. And so I think it further underscores, despite the fact that we have a tough budget situation, we got to get creative and think what more we can do. We went into this budget with some high-level principles that the secretary asked us to chart out, really focusing on preserving the progress we've made today, thinking about minimizing any impact on individuals and families as much as we possibly could, really thinking about equity at the center of some of the work that we continue to do and continue to instill in the way in which we do. And then not cutting things that were on the brink of being delivering results, because we didn't want to cut things or delay things and then be able to not reap the benefits of those to the people we're looking to serve. Now, it's not like those were high-level principles that we used in our negotiation. We also basically tried to do everything we can to avoid massive cuts by being very creative. We are upping the MCO tax in a different way to be able to generate additional revenue, to be able to avoid cuts to the Medicaid program, for example. And this is why we've been able to retain the expansion work that we've been able to push more holistically. So as we engage with our legislative colleagues over the course of the next couple of months, this isn't perfect. It is just a proposal. When we know that there's a lot that we're going to have to negotiate with the legislature on. We've had some very productive conversations. I've had some very productive conversations with the Health and Human Services folks in both the Speaker's office and the Pro Tem's office. And there's more work for us to have to kind of move in this direction. The thing that I'm very excited about, I think, despite where we are, and I think there's a lot more work to be done, I think the work at the Department on California 2030, kind of reimagining what our older or aging network really looks like moving forward, is going to be really exciting. This is not done in a vacuum. This has been kind of an ongoing effort that Susan, Sarah, and so many others at the department have been embarking on over the course of the last little while, to really begin to think about, as we begin to expand home and community-based services, both in the Medicaid space and the non-Medicaid space, how do we really think about a seamless entry into those types of services for people, and what does the aging network really play? And so for us, We look forward to working with you all to think about the proposals that help kind of reimagine what the 21st century older adult network really looks like. We would like to amend the Older Californian Act to be able to be more responsive to that. We also intend to work with our congressional delegation over the course of the next couple of weeks and months on the reauthorization of the Older Americans Act, with the idea that we kind of anchor some of the things that we're looking to do here via the Master Plan for Aging and CA 2030 in that space. So Susan and others with the secretary will be engaging with the delegation in a much more proactive way than we've ever had before to begin to chart a path. And we would look to each of you and you collectively as a body to help us think through what are the things that are important for us to think about, both in the reauthorization of the Older Americans Act, as well as kind of changes that we'd look to make to the Older Californians Act as an opportunity to kind of rethink what that looks like. I also want to say thank you to a number of you who have been in the space of long-term services and supports and long-term care more broadly. Kevin and Sarita and Nancy, and I know Doug and others who've been part of various conversations. I think you've really opened my eyes to a really complicated challenge. And I come to this, for some of you who don't know, have worked under the Obama administration on the Class Act and really looked at kind of how do we implement the Class Act and what do we needed to do to get the Class Act going. But I have become more familiar with the nuances of this issue in a way that I think I wasn't familiar with before. And some of the stories that I'm also hearing, and the story that I shared just a moment ago with you around the person who called me over the weekend needing support, I think is this is not something that is new, and I think it's going to get even worse, to be honest with you, as the population ultimately looks to age. And so one of the things that I've done internally is, thanks to Susan and a few others, is really bring a cross-cutting group of folks together. It includes the Department of Aging, the Department of Healthcare Services, the Department of Public Health, the Department of Social Services, to begin to think about what more can we as a state do and think about when it comes to long-term services and supports. And I do worry, because of the Class Act, the label of LTSS or LTC has been a little bit jaded. And I think that people shy away from it or don't want to engage because they think it's just a cost driver. And I think we need to almost reshape the narrative around what LTSS really is. And I love the idea of kind of thinking about it from the base of home and community-based services more broadly. I do strongly believe that it's an important thing for us to think about from two perspectives. From the perspective of making sure that people have the services so that they can live in the community and be with the loved ones that they want to be. But I also think that it's a way for us to negate people decompensating quickly by making sure that we're wrapping ourselves around them before they either eliminate their assets, and I know we're getting rid of the asset test, but eliminate their assets and decompensate completely and then have to get onto Medicaid. We live in a society where fundamentally we do not take care of the people who took care of us as they aged. And so I think thinking about ways in which we push the envelope in the space, more to come on that. I've started to talk to some of you about some of the creative thinking. Some of you probably think we are a little crazy and thinking outside the box on the Medicare stuff, but we want to push the envelope on the Medicare side in a more strategic way to be able to think about the forgotten middle and what we can do in partnership with Medicare to begin to think the way in which we do that. I admit it is a little cuckoo for Cocoa Puffs. When I brought Susan and others together, I said, you have a blank sheet of paper, and we spent some time thinking about what we could potentially do. And so we will be sharing with you all some additional thoughts. I know we're reaching out to some of you individually, but we'll also come back to you all as a group in short order around what more we can do on the Medicare side to push the envelope related to kind of that forgotten middle and ways in which we can think about that. So I just want you to walk away knowing a few things. First, thank you for leading this movement, which truly it is a movement. Two, I recognize that despite the fact that we have difficult budget times, people in our communities, the families, individuals you individually touch and serve, are facing extraordinary and very difficult times. And I know that people in my generation, or in the generation that my wife and I are in, we're saddled with both kind of the issue around our children in childcare or early care, and then having parents and older adults in our lives who are also in need of adult care, and what does that ultimately look like for them. And so that burden weighs very heavily on me. And I think it's important that we collectively think about what we do in that space as we move forward. So, Susan, I'll pause there. I'd love to hear from other folks kind of what is top of mind for them and their organizations, and kind of engage in a conversation.
Thank you. Thanks so much, Marco. And we do have 8 minutes until we open for public comments. So please raise your hand if you'd like to ask Marco a question or comment on anything that he said. Would love to hear from committee members. Kevin, please.
Yeah, thank you, Marco, for joining us. I don't know if you were able to hear the rest of the meeting, but it sounded like you did.
I was not, actually was on the Aspen call unfortunately, I wasn't able to join earlier. I was on this Aspen call with my counterparts from other states. So hopefully I'm worried now that I said something that was wrong, but it was productive conversation.
You took the words right out of our mouths.
Okay,
you hit on a lot of things that your colleagues at the state shared, and you hit on a lot of the ideas and concerns and things that we highlighted as a group as well. So really appreciate how committed and focused you clearly are on the challenge of helping people find care at home or wherever it is that they need it. You hit on a lot of things that we said, that this is a crisis that's facing family budgets, that it's becoming increasingly real and in an increasing number of people's lives. And we're ready and here to work with you on any kind of solution, as creative as we can be, just as long as we're keeping really front and center the needs of the communities and being as ambitious as we can, and really trying to push leadership, all kinds of leadership, to really understand just what a crisis this is and all the waterfall effects around affordability that impact families at all stages of their life and in all different kinds of ways, and being ambitious and bold in how we tackle such a pressing problem. So really appreciate your focus, your commitment, you're willing to get outside the box, and then reiterate something that we shared with Kim and Susan and Sarah too, just again, gratitude for a budget that avoided deep cuts to services, and understanding that the story isn't fully written yet. And so wanting to help you continue to lift up just how important the services we provide today are to our communities, and ensuring those services stay in place, even as we look to address the gaps as well and take additional action to meet families where the need is.
I think that latter part is really important. And I think I would urge each of you and your organizations to engage heavily around just how important some of these pieces are. I also think that, the narrative that we need to pin older adults versus young children, for example, is just baloney. And I think we cannot allow that to perpetuate. And so I think it's not one or the other, it's both. And we've got to think about that in a really strategic way. But I think given kind of the LAO's outlook with regards to January revenues, it is important for each of you to hit the pavement and make sure that people understand the implications of each one of these programs. We obviously put them as a priority, but I think that we should not take anything for granted over the course of the next little while. And so I think we all need to work together to both tell the story about the implications of this on individuals and then the system as a whole. And I think what we tend to do at the state, we focus at the system level and we don't focus at the individual level. We need to do a better job of thinking about what I love about CA's 50-year anniversary and the individual, if you haven't had a chance to, they've already published 6 stories around the, the first 6 years, but like the individual stories matter. And I know most of you, Nancy at AARP and Eric at Alzheimer's and others, you guys anchor your work in the individual stories, but I think they're more important now than ever before. And I would urge you to really lean into those in a pretty profound way.
Thank you. We've got time for a final question or comment. Anyone who hasn't had a chance to speak today? Sarita.
Yeah, hi, and sorry, it's a little bit of background noise, so I hope you can hear me. I just wanted to, first of all, Marco, express my gratitude for thinking that the administration has already put into this and the excitement around LTSS solutions as a priority. And I guess one quick question for you was around how this LTSS forgotten middle, missing middle work, how you intend to more formally engage stakeholders in the work that you're planning to do.
Yeah, so I think there's various layers of this. So layer number one is beginning to kind of make sure that we have some initial conversations with folks to make sure that we're not cuckoo for Cocoa Puffs completely. And so we are doing some outreach to make sure that like the framework makes sense. We will use this body, to be very frank with you, to kind of solicit additional feedback once we have a concept paper fully drafted to be able to think about that. I have engaged with my counterpart at CMS, at the number 2 at CMS, and Secretary Gali intends to engage Chiquita and Mina in a more meaningful way to understand what is possible in the space in short order with Susan. So I think there's multiple layers or multiple strategies as to how we think about this. First, trying to get a sense of whether or not we're totally crazy, to bring it back to this group for additional feedback iteration. We just put something on paper to get people's reaction. It is not perfect. It is not the final thing. It is just something to get people to react to. And we would love to kind of get people's feedback around what that looks like in the coming weeks and months. And Susan and her team will lead that effort as part of this committee in particular. And then we'll have a engagement strategy with our federal partners. And many of you will need to, we would like to enlist you in, if we do concurrently all agree that this is the path we want to go in, then we will need to enlist you all to help us kind of push the federal government to think outside the box. We think that we're getting them there, but I think it'll require more work to think about how we pull this together. And to be very candid and just to be blunt, we're also looking at this from a time horizon perspective, given the federal election is just around the corner. And so thinking of what opportunities can we get in before any transition does happen, and what that all looks like. So we're thinking about all of the different parameters as we begin to think about this. So we are committed to engaging with stakeholders in a thoughtful way. We want to co-create with you, and we would like to enlist you in helping us think through how we get the federal, our federal partners to this place.
Thank you.
Thank you. And we will, we're so fortunate now that we have this stakeholder infrastructure where we can tap into groups like this that exist. Our Disability, Aging, and Community Living Advisory Committee, our Equity Advisory Committee, our Alzheimer's Advisory Committee. So we really intend to leverage existing streams of work and other groups like the CADA group. There's an MIT collab. And then there is a piece of this that would include focus groups or listening sessions where we can really tap into the community directly. So as Marco said, it's unfolding, and we'll keep you abreast of our stakeholder work. Marco, thank you again for joining us. We always like to see you and appreciate hearing from you. We will now shift to our public comment segment of our agenda, and Carol will lead us in that.
Good morning. This is our public comment portion of the agenda, and attendees can attendees by phone can press *9 on the dial pad to raise the hand in the queue. And if you're attending by the Zoom webinar, please press your raised hand icon. I do want to remind you 2 minutes for each public comment. And I see one hand, which is Kira Jones. I'm going to unmute your line. Go ahead, Kira.
Hi, good morning, everyone. My name is Kiara. I work as a case manager down in San Diego. I work for Serving Seniors, and I work with seniors, all kinds of seniors, different demographics, different backgrounds. However, a large number of them are unhoused. A large number of them have previously been incarcerated. As mentioned, when we were talking about getting in touch with the Department of Rehabilitation, which is amazing. I think that's absolutely needed. My main question here is, how do we get the community involved? Beyond people who get paid to do this, beyond people who research this and who are passionate about it, as I am, how do we get, ordinary people within the community involved in understanding how serious it is that over 60% of the California's population by 2030 will be of an older demographic, if that makes sense. I saw a post earlier and I thought it was so cute, and it just showed how important community was, that in one Dutch country they had it where at a grocery store they had a slow checkout lane for elders who wanted to just talk about their day, and sometimes that's literally all they need. And then they saw how effective it was, and they opened it in over 200 stores within several countries. So, how do we get community involved? It starts with the community. These are great initiatives. I've been studying them since June 14, 2019, when Gavin Newsom signed off on them. But, as we've seen in the reports, there are some initiatives that haven't moved, that haven't made much progress, such as housing. And housing here, horrible, absolutely horrible. And with that, the older adults make up more than half of the population of unhoused people here. So, or a large amount, my apologies, not more than half, but a great amount. So yes, community, that's my question. That's what I would like to know. And I'm here to help.
Thank you, Kira. We appreciate that comment, and certainly we'll be taking note of the pictures that you've painted, especially with the checkout lines. That was great. Anyone else?
Thank you.
This is our public comment period. If you would like to raise your hand via the Zoom function, please do so. We have 2 minutes for each public comment, and I'm happy to take it now.
Okay, Carol, it looks like we don't have any further public comments, so we can go ahead and move into the closing portion of our agenda.
Sounds great, Susan. Thanks.
Did we by chance have a slide with the next meeting dates that follows this or not? Oh, there. Hey, what do you know? So I want to thank everybody for joining today, for spending 2 hours with us. I know how precious your time is, especially in the month of January with everything that's happening in your organizations and the legislature returning and the budget process. So thank you very much for giving your time today. And we really appreciated hearing from so many of you over the course of the agenda to hear your comments, feedback, suggestions. Keep it coming. You don't have to wait until April 25th to let us know what you're thinking. We always welcome phone calls and emails between meetings, but we will convene again on Thursday, April 25th. And we look forward to seeing all of you again at that time. And lots of webinars coming up, starting with the California 2030 webinar on the 30th. If you're interested at all in how we're strengthening the aging network in California, please join or pass along to your staff that webinar opportunity. And thank you, and have a great rest of your day, everybody.
Thank you very much.